Hello, everybody. Good afternoon. I have my orange tie on today. We have a big game tonight. Hopefully, we will beat Duke. Not a bad day. No new deaths to report, so certainly that's great news. Looking at our 7-day positivity average, 1.1%, lower than the state average, lowest out of any big county. They call us the Big Six in the state of New York. So obviously, great job to the community at large for everybody's efforts. We've now had 31,164 positive cases since March 16th of last year. That is 60 new cases. Out of the 60, 2 of them came from senior facilities, 1 from a senior resident. Our active cases are down to 667, which is positive. That caseload on, I think, January 3rd was over 6,000 active cases. So pretty stark turnaround, which is just fantastic. Hospitalizations, we have 79 individuals in the hospital. It's up a couple. Usually over the weekend, discharges usually aren't very active over the weekend, so we'll see if that number drops down over the next few days here. We have 11 of our neighbors in the ICU, so please keep those individuals in your thoughts and prayers. We need them to get well and get home. Related to some of the vaccine, so last week there was widely reported vaccine delays. We were able to kind of hodgepodge our way around to make sure that we didn't have to cancel clinics last week. We received, I believe, some of our vaccine allotment that we were supposed to get last week today, or so we will have a clinic on Thursday. We didn't receive all of the allotments we had, but so Thursday we'll have a clinic. We will have 400 appointments opened up tomorrow at 10 a.m. online to register. The focus for our pod will be, we'll have another clinic on Monday when we get the rest of our supply, but certainly we're focused in on comorbidities. Also, members of our community with developmental disabilities will continue to be a focus on Monday. We are really focusing in on educators and those who work in schools. They were the first group in 1B. We've been working with school districts and teachers unions on identifying who does not have an appointment left. And we have a number of educators that we'll get to this week on Thursday and then some on Monday, so that we kind of finish up that group of professionals. But really good participation in the vaccination process from our education, pre-K through 12, so that's great. Also, this week we will pull from OnList, and we'll also continue to work with our grocery stores and more public-facing grocery store workers this week as well. We don't know yet if we'll have a pop-up clinic. We've used our pop-up clinics to get into communities that, quite frankly, are not participating at the larger vaccination sites. We're continuing to get more and more data, and as we do, we see trends, and then we intentionally go to address those issues. So last week we were at the Shonard Street Boys and Girls Club, working with that neighborhood in our near west side, one of the poorest neighborhoods in the country, and that was a huge success. We are doing second clinics. Last week we did a second clinic at AME Zion in our south side. I want to thank Pastor Jaime again for his leadership in working with us. This week we have second clinics at Toomey Abbott, the Syracuse Housing Authority, and Dr. Weeks School, but we haven't heard yet if we'll get supply from the state for another pop-up clinic for first shots. Hopefully we will, and if we do, we will certainly put that plan into action. Symptomatic testing, let's just go over this. People need to take advantage of testing, especially if you left the community for last week. Don't go bringing back in anything that isn't wanted. If we got it, let's find it now. So, symptomatic testing, ongov.net/Cayuga Medical, Monday through Friday, 9 to 1. So if you have symptoms of COVID, please go to that website, go get a test done at the F-Shot. On weekends at Essentia Health, 8 to noon, same website, ongov.net/Cayuga Medical. Asymptomatic testing, we're doing a lot of asymptomatic testing this week. We're testing in the schools, and we're also testing in the community, the idea being to try to find any hidden pockets of the virus so we continue down the path we've been going, which is the downward trajectory. So asymptomatic testing, tomorrow we will be at the Northeast Community Center in Shove Park. Wednesday we will be at Fayetteville Village Hall, Town of Clay Senior Center, Skinny Atlas School District Office, Thursday Onondaga Town Hall, and Friday Lafayette Community Center. So please take advantage of the asymptomatic testing, rapid tests in the neighborhoods by you. There's appointments available. I promised you all some vaccine data last week after our pop-up clinic specific to race. At our clinic to date, and this is the on-center or pop-up clinics, right? This is not the fairgrounds or the drug stores. So our data is better than the data overall in the county because we're doing things intentionally. But race-wise, right now, 84% white. 80% of Onondaga County is white. 7% African-American. 10.6% of Onondaga County is African-American. 2% Asian. A little over 2% of our demographic is Asian. 2% all other. That demographic, that includes our Latino and Hispanic communities, that demographic should be about 4%. But the 4% declined unknown, these are folks who are not checking off the information. There's anecdotal evidence that some of this 4% do fall into these minority demographics. They're just not identifying with those. So certainly we got a little bit of work to do, and that's why these pop-up clinics are very important. Again, when we look at geography from our pod, 68% towns and villages, 8% out of the county, 20% city of Syracuse. So right now, based off population, the city of Syracuse, we need to do better and do more work. Again, that's why we want to strategically go into these neighborhoods in the city of Syracuse to bring access to these communities, and we'll continue to do that. Saying that, happy to take questions.
The president of NISAT said he spoke to the governor's team, and that he said that in order to get to these 3-foot barriers in between desks, 3-foot space in between desks, that barriers would need to be placed between desks. Is that something that's a part of the county's thinking?
Where we are with that is a little simple. And again, I'm sure the governor's having conversations with lots of people. In the beginning of the process on the guidance, there was a question of whether desks needed to be 6 feet apart if you were wearing masks. Mask is always, again, our public rule, right? Technically speaking, we all know wearing a mask is the smart thing to do in public. But technically speaking, if you're going to be within 6 feet, you need to wear one. So we've been through this, and we're every day that goes on in the pandemic, we learn more. I don't know what recommendations Dr. Gupta will make related to the 6 to 3 feet or 6 to 4 feet. We do know that the distance with the desks is a barrier that some of the superintendents are saying leads them to do some of these hybrid schedules. So when you're looking at the overall decision, I don't think it's as much about the feet between the desks as it is other factors, right? So what's your positivity rate in the community? Have you been testing in the schools? What's the testing in the schools? The reality is we're having more success in the schools because, quite frankly, anybody with any COVID symptoms, whether you're having stomach cramps, gets sent home, right? So when you're when there's very little spread in the community, and then you're eliminating anybody who has any symptoms, even if it's not anything COVID, but it could be COVID symptoms, that leads you to more success in the schools. And then to get back into the school, you got to go get a test, a symptomatic test, a PCR test to get back in. And then in addition to that, you're doing testing on top of that. That's all that data helps. And so I don't think the 6 to 3 feet is what has driven the success of the back to school plan. And because we have been having the mask wearing, the kids we know are washing their hands frequently, nobody with symptoms is going in. The transmission levels in the community are very, very low right now. And so the Dr. Gupta and her team, and just so everybody understands with our health department, it's not like we are just like this small little health department. You have doctors, we have epidemiologists on staff that this is their job to do these things. They are the public health experts, not other groups. So I think Dr. Gupta is looking at it, and they'll make a recommendation to me at some point, and we'll follow the recommendation. But overall, finding balance in the pandemic is always tough. And anytime you got to take a step forward, people get anxious, and we get that. We've been doing this, and we've had to take step forwards, and every time we do, it creates anxiety. And so it's finding the overall balance, and that's where I think we need to be now. We now have 79,000 people who've been vaccinated. Many of the adults in these buildings have been vaccinated. We want to get them all vaccinated. But some of them are not going to get vaccinated because they choose not to get vaccinated. So what are we going to say? We're just never going to go back to in-person learning because 5, 10, 15, 20 people in a building decided they won't get the vaccine? It's never about getting to zero.
When do you expect to get the recommendation and make this decision?
I talked to Dr. Gupta about this Friday. She needs time to do her job, and we're not going to put pressure on that. You don't just, again, a lot of thought process went into these schedules with the superintendents and their own districts and their own communities. You don't just all of a sudden say, you can go do this. You'll give time. If the recommendation comes in, you have to give the districts time to think about what this means to them. Can they go from 2 days in-person learning to 4? Can they go to 5? Many districts already are at 5 right now. And the other thing too, the data tells the story, right? If we all want to be not accused of making decisions that favor one group or another, you just look at the data. There's 667 active cases in Onondaga County. Okay, we have 462 to 467,000 people. And so we are a much different spot than we were on January 3rd when we had 6,000 active cases. And so then when you look at this, and then you look at various, how it impacts schools or communities where the people live, we have some communities right now that have a handful of active cases, like literally a handful. So making an argument that there's more risk when the kids that live in that community going to school an extra 10, 12 hours a week, that's not a strong argument, right? So, again, the data tells the story, and with everything we've done, when Dr. Gupta came up with the guidance related to at-risk sports, there's circuit breakers in there, right? So if we see spikes, we said you can have the winter sports season, but if we see spikes in positivity rate, and our contact tracing shows us going back to that, we reserve the right to change our mind. And Dr. Gupta specifically gave herself more flexibility that maybe if we don't see spikes as a community, but we see spikes within the athletes, the student athletes themselves, she has the right to change her mind. So this isn't something that we're going to push the health department on. I understand parents are excited about the prospects. I understand that within some members of the workforce, there might be anxiety because it's change. It's been, our educators are exhausted as well, like everybody else, and they've had to change the way they do their job, and it's very difficult. So it's about balance overall, and we'll find it.
The last time I
Several-
remember hearing you talk about this level of anxiety, it reminds me of the phased reopenings. Do you think normalizing the school day, the school week, is the next challenge as a community to start pushing in a, more normal direction?
I think it's important when what we have to start thinking about, Andrew, overall, and today we're talking about it in context with schools. Public health is bigger than catching COVID. And COVID has impacted us in many, many other ways. And we as a community will be dealing with that for years to come. So when we look at all decisions now, as we're starting to turn the corner, and we're having victories right now. This is 1%, 1.1% in the middle of winter when we're indoors and it's going down. We're having small wins here on the battlefield, and the vaccinations, we're starting to develop that immunity. So when we're looking at the overall public health picture, you have to start factoring in all the public health issues that we're facing, and mental health being a huge one. How is it impacting our most vulnerable, our seniors, our kids? The fact that we're dealing with a raging opioid crisis that we haven't even really been able to get our arms around yet. The fact that we're dealing with a suicide crisis that we haven't been able to get our arms around yet. All of this has to be weighed into all of our public policy decisions now. We're at a better place where as leaders we can do that. And so I think this is just how as we take these next steps, there's going to be steps that you're going to see different parts of the economy opening up more. People are going to be anxious about that. Some people will be very happy. Some people will be anxious. Let's follow the data. Let's let the data determine everything. But part of this data isn't just on this piece of paper here anymore, Andrew. We know what's happening in other public health realms. We know we're losing life to this pandemic, but not directly by COVID, but by the decisions and actions that this virus has made society have to take.
County Executive, out of all the superintendents I've talked to recently, all of them say that reducing social distancing in classrooms isn't the only problem. We need to reduce that on school transportation as well. Is that something that could and probably will be a part of the
Yeah,
back-to-school plan?
I think you'll see again a lot of these social distancing requirements. That the health department will look at it, and again, and maybe you'll be comfortable doing desks, but you won't be comfortable doing the buses. I'm just suggesting that could happen. I could see it happening. What does that then mean? Again, we're not there. One thing, we're not going to be kind of pushed into a haste decision on something if the data is not there. The data very well could be there to make certain decisions, but not others. I think that our health department's looking at it, and so far the data-driven approach in this county has helped us get through this pandemic.
Ryan, are you surprised at how good the data is? It's a national trend that the transmission rates are falling off, but what do you attribute it to?
Yeah, I think I am surprised, and I'm surprised. I would have taken 5% through the winter, to be honest with you. I think the vaccinations is playing a big role. If you look at the hospitalizations, I think there's a direct line. I think 8% of our hospitalizations were related to senior facilities. 33% was a norm number before the vaccinations. So when you look at who's going to the hospital, who's going to the ICU room, and then who's having the worst outcomes, the vaccine's driving that. That does help with caseloads as well. I think we got stuck in kind of like a tornado of activity with social gatherings that really pushed us to the limit for a couple weeks there. And I think we realized that. I think the month of December and going into January was really it was a terrible time for our community when we looked at the outcome of loss of life. And we got hit hard in May, but it wasn't like that. And so I think that woke people up. And I think everybody went from knowing people who had COVID to then knowing your neighbor had COVID, then knowing someone in your family that had COVID. And then, unfortunately, most people know somebody who died from COVID at this point. So I think that changed human behavior as well. And so since then, we've been doing what we need to do as a community. I think with what the community is responsible for, certainly the testing has helped identify the virus and hidden pockets of the virus. And that's why we continue to put so many resources to it.
What percentage of teachers in the county have been vaccinated, and is there any plan to kind of keep pushing that?
Yeah, well, again, we've identified, with the help of the unions and the superintendents, we think 450 educators in the buildings that haven't been vaccinated. So now that doesn't mean there aren't some that just won't get a shot. These are the willing. So they're going to get vaccinated this week. And there are probably some educators or who work in the buildings that have appointments that haven't been vaccinated yet, but they have appointments. So I think overall, you're seeing really great participation from educators to get vaccinated, which is very helpful. And we essentially are getting to the point where we're getting very close to a vaccinated, those who are willing to get a shot.
450 is the total number of people in the education category in this county who haven't gotten a vaccine?
We've been working with the unions and the superintendents. That's what they are telling us.
Total
450
out of what, like 6,000?
I think it's probably a little more than that, but yeah. I know we've done, at our pot alone, we've vaccinated over 2,000 to date. So we know the fairgrounds has been very busy as well.
Would you just go through the 400 appointments? Those are just appointments out on the website for the available
Yeah.
public.
Yeah, any 1B. So you have you're immunocompromised, and certainly anybody else who's in the 1B category can go
what numbers
register.
are you putting toward the on-list, toward the doctor-referred comorbidities? If you could just go through.
Yeah, so
kind of break
we'll
down the
probably
supply.
have 1,800 this week. We'll do 400 appointments to the public. We're going to do 200 to OPWDD, which is our developmental disability community. We will again work with doctors this week. We may open up more to the public on Monday for our immunocompromised category, but we are working with some doctors as well this week to pre-register the vulnerable of the vulnerable. In addition to that, the 450 educators we want to get done, whether they're working in the buildings. And then certainly we will dedicate on list. And then we did reserve, I think, 60 slots for members of the New American community as well that we've identified that are ready to get a shot. So so overall, roughly we got 1,800 vaccines to work with. 400 for Thursday will be open to the public to compete for, and we'll probably add to that to Monday as well once we know A, that the vaccine's on hand, and then B, how many slots we decide to give to doctors. This week, some of the dialysis units in the community did get direct allocations for vaccine. They'll probably receive it Thursday or Friday, so they'll probably be giving shots Monday. So that was part of our network when we're looking at the most vulnerable of the vulnerable. Usually your dialysis units are a good spot to find people that really need the shot. So some of them are getting direct allocations this week as well. But you look at the community overall, we're going to have, by the end of the week, probably 85,000 people with first shots. When you look at everybody collectively, maybe even more. When you look at that and you look at the fact that we've had 31,000 people who've had COVID, many have levels of immunity still, this helps tell the story, too, of how we're turning the corner. And so we're making progress. It's never fast enough, but we really are.
Has the demand gone down for appointments as, you hit 85,000 people before you had 1 million people trying to go on board
Yeah.
all at once?
Yeah, I think you're seeing the fact that our supply's gotten a little bit larger. The the fairgrounds, they haven't shared directly the allotments they get, but we help staff the fairgrounds, so I have an idea on the supply they have each day. So they're certainly doing at least probably about 1,000 shots a day. And so when you have that, a lot of those have been new appointments recently. Before, in previous weeks, those were already appointments that were there from the day they put the link available, right? So they've added new appointments, which is good. Each week, the pharmacies are getting to more seniors, which is good. And our supply's gone up, not nearly where I want it to be honest with you. We can do much more. They should utilize our infrastructure more. But having us doing more as well helps. And then we get these pop-up clinics, which is new supply that week in the community as well. So is a couple more weeks getting through the 1B now here, I think will really put a dent into that population. And then I think you know 3-4 weeks from now you might see some new eligibility from the state.
I was going to ask, if it were up to you, when would 1C open?
We got to get through. We need really real solid data on our seniors. I think we're making progress there though, Andrew. And then we need another couple weeks to really get through our immunocompromised. And once you do that, then I think you can start to look at different, targeted eligibility. I don't think you want to just go full blown unless we have thousands and thousands of new shots into the community. But I think you could probably look at more targeted participation then.
About a month from now?
I think so. I think about 4 weeks. I think so.
What group are you finding isn't getting the vaccine that is eligible?
Yeah, I think I'd be interested to go back at our partners in law enforcement to see the participation there. We've basically exhausted that. I think at some point some members will. I think they just aren't there yet. But I think everybody else. Again, it's tough for us to answer that question because our communication with people is people pretty desperate to get the vaccine. And again, those who aren't interested in it aren't calling us. But, I think overall, I think for the most part, people in this community want to get it and will get it. And in our some of our minority communities, we've learned that the most efficient models to distribute the vaccine just aren't the best models for those communities to participate in. The on-center, this building is next to the bricks across the way and the Syracuse Housing Authority. And so, but those folks aren't going to come get a shot here. That just hasn't happened. So we know the pop-up clinics is the way to get into these communities. And so we need to have dedicated, intentional efforts to continue to do that.
I may have missed this, but did the county develop an alternative attestation to a doctor's notes for immunocompromised people?
We have not done an attestation yet, Tim, but certainly.
Do you have to have a doctor's note?
Right now, that's what we've asked for. That wasn't an issue last week. I think this week, I don't think it's an issue. We're talking to Dr. Gupta about potentially prescriptions and different things as well. That change your process inside the pod a little bit, but certainly, we're looking at that. And I do believe an attestation is probably, we're going to need to go there for future weeks as some of your comorbidity categories aren't as severe. So I think at some point that's probably where we're going to be.
And you've designated some of the shots this week to go through to targeted people in addition to the 400?
Correct.
How many are targeted for comorbidities?
We'll probably have at least, so we may open up some of this, but we probably have at least 18 or 200, at least 600 shots that are going to be targeted for comorbidities. Whether we get 600 from doctors' offices or not, we reserve the right to open up some of those to the public. But overall, you'll see more than 600 with comorbidities because out of the 400 we'll put out, many of those will be folks who have them.
Have you talked to nursing homes about visitation? What do they think about the guidelines that, I don't know if you haven't had a chance, because one just had his call, but
Yeah.
talk about welcoming families.
Yeah, I haven't seen the specific guidance on it. I think right? Sensitive topic. You know, but the reality is these folks have been vaccinated. The employees are still being tested. Residents are still being tested. There's a reason we're finding cases. Some of these cases, these folks aren't sick. Some of them are asymptomatic. And so these folks need to see their families at the same time, right? So you need to utilize the technology at this point to let folks in now that the residents have been vaccinated. I think it's even better if the families are vaccinated too, but recognizing not everybody's eligible. But it's a quality of life issue, and obviously it's something that where we are with this pandemic now, I think it's appropriate that these families get opportunities to see their loved ones again.
What's driving the cases that are still coming in? 60 new ones.
Yeah, I'll have to talk to Dr. Gupta to see if there's any real trends. I mean, I don't know what today's numbers look like. I haven't seen a breakdown yet, Andrew. I just think you're still part of these 60 are going to be household contacts, right? So those are always, once you got it, tough to keep your family away from it. And so I think that's certainly a piece of this. I'll be watching to see if we get a little bump with travel from last week. I think that's likely, right? People did go away on winter break. So we'll probably see a little bump in cases. Whether we see a bump in positivity rate, probably not, because people who are coming back from travel that don't have it are going to get tested out of their quarantine, because that's the rule, and everybody will follow the rules, right? But I think that's a little bit of a risk, so we really need people to get tested.
Well, that brings up a good point for people watching this just back from break who may need an update on what's expected of them. What is expected of them?
Yeah, you can test out after 4 days, but you got to get a test. And so if you've received both shots, you don't need to quarantine for 90 days since your second shot. But certainly for families that traveled, and again, I think I saw some of them when I walked in here, just you take advantage of the testing. Test out of your quarantine. Make sure that you're safe before you come home and see other family members, that you don't have anything. And we'll continue to see cases down, and we'll continue to take 2 steps forward, in this pandemic. But I think that's, right now we're in a good spot. So some folks, mental health, they needed to travel, okay. But now you got to make sure that when you come home, you're not bringing anything with you.
Quarantine is 10 days?
I think it's 4 days, I believe, as far as you can test out after 4 days.
But if you don't test, it's a normal.
Correct.
Normal,
10.
It was 14. 10 now.
Yes.
Is the latest.
Yes. Yep.
Some people in my newsroom are curious, where did the idea of be it 3, be it 4 feet come from, or just, I guess, reducing the social distancing? Because on the CDC's website, 6 feet in schools, 6 feet is still recommended, and as far as we can tell, the state has not necessarily recommended 3 feet be the
and districts and superintendents, and in the beginning of this was a question if you could do 6 feet or 3 feet with the desks. So there was people suggesting that it was a local health department decision. So when people suggest that to me, I go to the source, and I went to the source, and they told me, yes, it is a local health department decision. Okay. So do I talk to Dr. Gupta when our positivity rate is 1,000 active cases and we are doing case investigations on 400 people a day? The answer is no, I do not talk to Dr. Gupta about any of that then. When we start to see things going down, do we have conversations? We start to have early conversations. When we see things at 1.1%, and we've arguably over 25%, 25% of our population has immunity, whether it's natural or vaccination, and you have 600 active cases, certainly now's the appropriate time to really look into it. But yeah, that's the folks have been advocating for this change, because when they go to their superintendent and say, why can't my kid be in school 5 days a week, this is being thrown up as one of the barriers. Then they say, well, whose rule is that? we think it's a state rule, but some people suggest it's a local health department rule. So then it gets thrown in my face that it's our rule. I didn't think it was our rule, but let me go check. It's not our rule, but is it our decision to do something different? And that's how the process plays out.
I'm wondering how you work with other county health departments, whether it's athletics or where that guidance may, interact with other counties or conflict with other counties. How do you figure that out so it's manageable for people who live on the border or are part of an athletics team that travels or anything like that?
Yeah, so as county executives, we have our own group, right, our own association, and then your New York State Association of Counties incorporates all counties. You have health department directors and then commissioners. Dr. Gupta is a commissioner. And they all have their own group, right, like amongst their peers. So we, as executives, you deal with all the issues from every single element of it. The health directors and commissioners deal with it as it pertains to specific things. So Dr. Gupta talks to her peers about what they're doing and what they're seeing and different thoughts. The 6 feet to 3 feet, for example, they've done it in Europe. That's so that's where all the best data is on that issue. But for me, we have county executive calls probably weekly where we get to talk to our peers and talk about what's going on. And you develop, again, these folks are people that you develop a bond with because there's very few people that know what you deal with on a day-to-day basis but them. And so you develop personal relationships with, and you share your successes and you share things that didn't work out as well. Other questions?
Brian, has there been any issue with no-shows for second shots?
There are some no-shows on second shots, and so then you try to hunt them down to reschedule them, and then at some point the question becomes, and I'm not sure the exact policy if we've been here yet. No-show second shots. At some point, are they never show second, and you have that second shot? Then you look at the guidance from the state on where you can use that shot.
Is that there's enough of those to kind of be a nuisance?
Not yet. Again, if you have somebody who has a minor reaction after the first shot, scared to get the second shot, some of the vaccine data now that we have now is pretty powerful data that suggests you have larger immunity than thought after the first shot. So some people may not want a second shot. And then, again, usually when we have a no-show for a second shot is they got the date wrong, and our team's hunting you down, calling you to try to get you back in. But there probably has been a handful of cases of they're just not going to come for second shots. Then you go and you get those shots in someone else's arms.
Have you had any conversations with the state about the state fair?
Not yet. Not yet. I think I think the War Memorial Amphitheater, those are things that I think on our timeline that are more pressing and are in, quite frankly, our control to operate. We have things we want to do there. Getting out the guidance and the rules on that. I think the state fair, although we're the host, certainly the governor is going to make that call.
Well, back to the War Memorial, what have they said about those under 10,000 people venues?
We're pushing them. To me, again, we're an 8,000 person arena compared to a 10,000 person arena. No real difference, right? So we think that there should be fans at the War Memorial under the same guidance that there are fans at some of these other venues. So we're pushing them. Hopefully we'll get an answer on that soon.
Pushing specifically for the War Memorial?
Correct. They want to look at it. They want to address the thing statewide. That's fine, but I'm advocating for our venue.
Specifically because it's crunch season now.
You got the season now, and it's again, if I was we had a 2,500 person venue, and they're saying 10,000, that's a little different. We're an 8,000 person venue. The Rochester Amerks can have fans, but the Syracuse Crunch can't. Doesn't make a lot of sense.
What's the Rochester capacity?
Around 10, yeah.
Tomorrow's the day for on-list people to watch their email, is that right?
Correct. Correct. Other questions?